We were approached by Riverside to continue a partnership. We already have it with the fire department. Riverside will have an individual patient that may have a stroke. They'll in turn assess the patient, and then they will send that patient's information over to my community paramedicine staff for a follow-up. And it comes over as a referral with the patient's assessment and what actually we need to follow up on that patient. And ultimately it gives the patients a peace of mind to know that there is somebody that's out there that's going to follow up care once they're discharged to prevent them from going back to the hospital again.
While I was in the hospital and we were in the process of figuring out whether they were going to let me go home because I was really having a hard time with the walking and the movements and the talking and things of that nature. So when they brought the paramedicine program idea to me and explained to me, that I would have nurses coming, I would have speech and physical therapy, and I would have EMT that would come once a week and do my vital signs and everything. It reassured me that I had a whole team that will be there in the instance that something came up that I wasn't sure I could handle or my family could handle. So I was like, okay, I agreed to be a part of the program. Best decision ever. And now here I am, a year later, I'm back driving. Every now and then I still get a little tired, but for the most part, I'm almost back. I would say I'm about probably 97% back to myself from a whole year ago. So, Riverside rocks. Awesome.
I think that stroke, for me, it's actually one of the scariest things that I see a patient come in with. It's scary for the patient, it's terrifying for their loved ones. It presents in so many different ways. And I think just working here at Riverside, especially at a comprehensive stroke center, when you work with the stroke population here, you get to see a miraculous recovery for some of them. And just working with the program, I get to watch patients as they come in with our EMS providers, and I get to follow them through that entire stroke continuum. I think just being able to watch them go through that recovery process is what really drew me to the stroke population.
So I think one of the biggest values for me is this partnership that we have with Riverside. And not only do we get the support from Riverside, being able to involve in their process, we kind of go, well, we also do stroke in-house, but we're also part of this, part of the community. So to me, that was a huge thank you kind of thing for Riverside. Was now you're involved, now you're kind of part of the hospital system. We've adopted it. But I think as far as if they weren't really partnered with it, it would be a struggle for us to kind of try to find some of these patients that would need help, as opposed to they're in the hospital and before they get sent home, they're identified. So to me, the partnership is huge.